Measles vaccination rates have declined during the COVID-19 pandemic, and now nearly 40 million children are susceptible to the disease, according to a joint report from the World Health Organization and the CDC.
Our chief health editor, Dr. Partha Nandi, joins us now. And doctor, could these lower vaccination rates lead to a breakout?
Yeah, Glenda, you know, there have already been large outbreaks in 22 countries around the world. This is very disheartening to hear because the measles 2-dose vaccination is 97% effective at protecting against this extremely contagious virus. Now, this new report found that 25 million kids missed their first dose. That's a lot. And an additional 14.7 million children missed their second dose in 2021. That's nearly 40 million kids in 1 year, which is a record high. And no surprise, many of these delays can be blamed on the pandemic, right? In 18 countries, 61 million measles vaccine doses were either missed or postponed due to COVID-19 delays in immunization campaigns. This is definitely a setback in my opinion. In fact, last year worldwide there was an estimated 9 million measles cases and 128,000 deaths. In order to create herd immunity and protect communities, we need at least 95% coverage. But so far, only 81% of children worldwide got their first measles-containing vaccine dose, and only 71% have received their second dose.
So we know there's still sporadic measles outbreaks here in the U.S. What are the risks for our kids?
Yeah, so we know that there's been a recent outbreak, Linda, in Columbus, Ohio. 32 cases have been reported since the start of November, and 13 kids have been hospitalized. Of those 32 cases, 31 were unvaccinated and one had an unknown vaccination status. So this really shows how well our vaccines work, in my opinion. Now, once a person is infected, symptoms can include what? A high fever, dry cough, sore throat, inflamed eyes, and a red blotchy rash. Unfortunately, measles can lead to other health problems like ear infections, diarrhea, pneumonia, encephalitis, which is swelling of the brain, can be serious. Those most at risk are pregnant women. Measles can cause premature birth and fetal death. Also, people with weak immune systems, they can develop a type of pneumonia that sometimes leads to death. And babies under the age of 1 are also at high risk. Now, I can't stress how important it is for everyone to stay on their vaccines. I keep talking about this, but you got diseases that we should be able to control that we're not controlling because of it.
All right, Dr. Nandi, thank you. We appreciate it.
My pleasure, as always.
And if you have a health question for the good doctor, you can email him at drnandi@askdrnandi.com or send it to us, Facebook or Twitter. We'll get it right to him. Brian.